kid, every kid.
Everybody, so get her out of there. You're going to the slammer. You can start going to the slammer. Going to the slammer. Right there. High five, Desire. High five.
Our team in the Heart Lab is focused on reducing autism health disparities through the development and evaluation of innovative models of care, both here in the United States and globally in resource-constrained settings. We have a major public health problem here in the United States, where children and their families are often waiting months or years to access autism diagnostic evaluations. And that's a real problem because they're missing opportunities for intervention and family support at the most critical time in their development. Our research focuses on understanding who is at greatest likelihood for experiencing those disparities, and then how we can tailor our care delivery to address those problems so that every child and their family has access to care.
My research looks at sort of basic mechanisms underlying autism and tries to translate that to the real world. In the Heart Lab, my role is really to sort of deploy some of those tools that we use in the lab. Eye tracking is just a tool that allows us to see where individuals are looking. We also measure things like their pupil diameter, which can be mapped onto particular circuits in the brain. And those looking patterns and those brain circuits differ in autism in very subtle ways, sometimes that can't be captured by behavior. So we use eye tracking as a tool that might be a little bit more sensitive to some features of autism that will allow us to identify autism earlier and more accurately.
I'm so passionate about our work here at IU. One of the biggest reasons is my daughter, she too has autism. She's 23, and she's come a long way because we were able to identify her at a young age. The mission of our team is to identify autism early, because at that young age, getting those interventions early is going to help with outcomes later, like it was for our family.
When we first got this diagnosis, he was not really talking, pointing, following directions, no sense of danger. He never identified our family members as, by their name, or never really called me mom.
The importance of early diagnosis is the awareness, for one. If you're not aware of what you're dealing with, you don't know what to deal with.
Now we know everybody's name. He walks up and he introduces himself to people and shakes their hand. He attends a gen ed preschool. He's going to private preschool next year. He's your typical 5-year-old. He has no limit.
He has exceeded some of the things that I was worried about. He's someone who I believe will be able to read. I know he can because he identifies words. He's someone who could write a book. He's someone who's going to drive a car. All the things that you look forward to experiencing and enjoying with your child, he showed me that I'm going to have those experiences.
The team at IU has become part of my village. If I reached out and had a question or needed an answer, they were a phone call away. It wasn't just because the research part of it was over and he got his diagnosis, they just dismissed us. They were there, we needed them.
The problem in accessing autism health services is so great that we can't solve that alone. We have to partner and innovate with new technology and other scientists in order to improve the care that we can provide to children and families. And so when we collaborate, the impact that our team can have on children and families is so much greater.